Welcome everybody to this week's press briefing on COVID. The big takeaway from this chart is that we continue to set new records each week and continue to increase in the number of patients in the hospital, number of patients in the ICU, and number of patients using a ventilator. In particular, you can see we had a new record of 604 daily average census of COVID-19 inpatient hospital patients. We had 169 this last week, which is well north of our previous record of 116 daily average census of patients in the ICU. And our ventilator use is at the highest level we've seen so far as well, up from our peak of 60 patients to a daily average census of 98 in the previous week. The big takeaway from this chart is the numbers continue to increase. They continue to increase at an alarmingly fast rate, and we do not see a peak in sight. Crisis standards of care remain in effect for Panhandle and North Central health districts. This is a result of a surge in COVID-19 patients with an already existing staffing shortage. And I wanted to take a second to clear up that the staff shortage is not a result of vaccine requirements at some hospitals. None of the hospitals in North Idaho have a vaccine requirement. Here in the Treasure Valley, St. Luke's is reporting that they currently have the highest number of employees in their history. The staffing shortage in Idaho has been long-standing. What has changed is a massive increase in COVID-19 patients needing hospital care. Hospitalizations in Southwest, Central, and South Central health districts, which includes the Treasure Valley and the Magic Valley, are reaching a critical point. Without a change in direction, crisis standards of care are imminent for all three of those health districts. Just to be clear, crisis standards of care affect all of us, not just COVID patients. There are already many patients who have had to delay surgeries or other treatments, and during crisis standards of care, tough decisions are made about how to allocate scarce medical resources. So for all of us, be a little more careful in general and reconsider activities that could land you in the hospital. The answer remains the same: choose to get vaccinated. For all of us, we also need to wear a mask indoors and in crowded outdoor spaces. And in fact, we'll show our usual vaccinated versus unvaccinated chart. This data is from May 15th, when everyone became eligible for a vaccine through last Saturday, September 11th. And you can see here that the numbers remain the same. About 90% of cases are from unvaccinated individuals. 91% of hospitalizations are for those that have been unvaccinated, and 88% of deaths have been from unvaccinated individuals. The takeaway is that vaccines work. They're safe and effective. For those of you that have been vaccinated, we say thank you. And for those of you that have not yet chosen to get vaccinated, we urge you to consider doing so.